Hey everyone, it's Tremia, and I'm here with part 2 on the Medtronic pain pump. In part 1, I talked about my pain management doctor referring me to the surgeon that specializes in implanting the pain pump. And I also spoke about what the pain pump is and what it does. The second part, my surgeon, he referred me to a psychologist, psychiatrist, one of the two, I don't know which one he was, for a psychological evaluation. Now, I had to do this because of Medicare. Medicare is one of their requirements to get the surgery, to get the pain pump. And I believe if Dwayne's insurance was primary over me, I wouldn't have had to do the psychological evaluation, but there would have had to been a pre-authorization. So either way, there's going to have to be something to approve you to say, you can do the surgery. We went to to get the psych evaluation, and it was a very casual atmosphere. It was a 400 questionnaire. I think they asked you the same 20 questions 500 times. That doesn't equal up in mathematics, but that's what it felt like. They just reworded the same questions over and over. And, it's like, didn't I answer that, like 5 questions back? And yeah, you did, but it was just worded differently. And, just don't worry about it. I just didn't worry about it. I just filled in my little dots and just went on, trying to get the questionnaire done and over with, because sitting up in a regular chair in a waiting room was not very comfortable. And then they called us back for our appointment with the psychologist, psychiatrist. And, he just spoke to us in general, just everyday, questions. I think what they're trying to do is weed out people that are seeking drugs, people that are abusing drugs, versus those that are in chronic pain and really need, help. And they want to make sure also, if you are in chronic pain and you need that help, that you mentally can handle everything that you'll be going through. And so I got a call the next day. Well, to finish that off, we were up there, and that probably took about 2 hours from start to finish. And, we went home, and they called me the next morning and said, the doctor said that, or the psychologist said everything was fine, that he approved me, that I was okay to follow through with the surgery, and that they were forwarding the information to my surgeon, and which they did. And then my surgeon's office called back, for which will be part 3, and it's the trial period. They call it the trial period, and it's basically a day of them testing you as if you have the pain pump. They go in and put a catheter into your epidural space and inject, different quantities of medication. And I'll tell you about that in the next part. But that's the third part of getting the process of getting the implant is the trial period, and to see actually if you're going to have pain relief or not. So that's what I'll talk about in part 3. I'll see you guys in the next video.